Hi, my name is Dr. Jeff Lancet. I'm from the Moffitt Cancer Center in Tampa, Florida. And one question that often comes up with respect to the diagnosis of acute myeloid leukemia is the issue of importance of genetic testing at the time of an AML diagnosis. And maybe in the past, that wasn't such an important issue because the treatment options were so limited that it didn't really matter what subtype of AML you had or what the genetic features of the disease were. But that's clearly changed over the last several years. And I think there are a variety of reasons why it's very important that all patients with a new diagnosis of AML undergo a comprehensive panel of genetic testing. And the main reasons include, number one, they're very important for prognostic purposes. So a patient with AML with a certain type of mutation panel, genetic panel, may do very differently and have a very different outcome than another patient with a very different molecular or genetic panel. So from a prognostic point of view, it's very important to really understand the molecular profile of the disease in order to better predict its behavior and to be able to share an overall prognosis with the patient. The second reason for really gaining insight into the molecular features of the disease and to do full genetic testing is that it may very well influence the choice of initial therapy. So an example of this would be a patient that has, for example, a FLT3 mutation. The FLT3 mutation is one of the most common types of mutation in AML and historically is associated with a poor prognosis, but is also a target for novel therapies. And we know from recent data that the addition of an inhibitor to the mutant FLT3 protein results in improved survival compared to treatment without that inhibitor. So this is an example of how obtaining a comprehensive genetic analysis that may reveal the presence of a targetable, or what we may call actionable mutation, can translate into a different treatment plan and ultimately better outcomes for patients if they receive that specific type of targeted therapy. And there will be many others coming down the pike as well over the next several years that will allow us to further stratify and treat patients accordingly with respect to their genetic profile. And then thirdly, it's very important to obtain a comprehensive genetic profile at baseline because these genetic abnormalities, which are common and present in most patients, some type of genetic abnormality within the leukemic cells, these mutations can serve as markers for how you follow the disease. So if you know what you have at the very beginning, then you can track it over time and determine whether it goes down or disappears over the course of treatment. And we've learned over the past few years that it's very important to downregulate these abnormal genes or proteins because if you do so, then the prognosis improves. And if you have residual or leftover disease as measured by these abnormal genes or mutations or proteins at baseline, if you have them left over after treatment, then the outcome is not as good and you may need to go on to some other form of more intensive therapy or maybe investigational therapy to try to knock out whatever's left. So these genetic markers can be very valuable in serving as markers for residual disease, which ultimately impact the prognosis and the treatment plans as well.